So I can give you an overview of what this is. I'll say with a caveat, I'm not an ID specialist. I'm an emergency medicine physician, and my information is also filtered through channels people have as physicians. So there's a general fund of knowledge we have, but there's particularities, and so I don't want to speak to areas that I'm not expert in. And I'll also say, actually, I'm going to give some props, I guess, because people sometimes don't trust our medical authorities, but I think Dr. Anthony Fauci has done an amazing job. Like, just to be honest with you, in communicating with the public, raising issues with the policymakers, and those sorts of individuals, I think, should be prized, whether they're from our community or not, who are able to communicate in a very simple way to the population. So with that, I'll say, so I think you should follow his YouTube messages or whatever from the CDC.
Can you repeat his name?
Anthony Fauci, he's the director of the National Institute of Allergy Diseases in DC. So coronavirus, right, is a part of a family. There's a family of viruses, coronaviruses, right, that are part of the same family, which we get the common cold from. The challenge here for us is that this is a virus that is different from ones we've seen before. There's questions, and we're not going to get the theology of mutation and evolution here, but it's a question of how it arose, where it came from. WHO sort of thought that maybe this came from animals, right? Like the swine flu did. They mutated and then started infecting human beings. Things are still not fully known, right? This is data that's new. But for us, the problem is that it became something that globalized, right? So you heard that it's now a pandemic. And what that really means is the fact that there's increased incidence of community transmission, right? So while this started in Wuhan, Hubei province, that was people related to that were getting infected. Now we have community transmission in the United States where there's no connection to that initial area, right? And if you have that in one area, fine. But if you have it globally in many different countries, then the WHO calls it a pandemic. And that's what we're having. So in Chicago, right, we are concerned.
By community transmission, you mean to say that it's not being imported over anymore, but the fact that it's entered the community by members giving it to other members within the
two different things.
Is that what you mean by that?
So two things. One is, it's not imported from somewhere else. The other is we don't know, we can't connect the dots to that locale, but people have obtained it, right?
Got it.
So you could say, if we quarantine, so this is why the idea, okay, let's not have any travel, we have a travel ban from China, which the United States did early on, right? Because, okay, maybe all the cases were there if we couldn't stop people from coming from there here, but now you're having community transmission, meaning we can't actually trace how they got it. So Chicago has had, in my own hospital, we had the first case today, University of Chicago, and I think there's like 29 or 30, maybe now it's 50 cases in greater Illinois that we're worried about. In the United States,
up from 11,
right?
A couple of days ago.
All right, so I'll talk about the growth curve in a second, but there's like over 1,600 cases in the United States. There's been, I think, over 40, 50 deaths. Globally, we're talking about hundreds of thousands of people and thousands of deaths. So this is, I think, the context becomes, right, pandemic. It's interestingly enough, it's a cold type illness, but we are calling it influenza-like illness. So it's not the flu, but for most people, they understand what the flu is, right? You have a fever, cough, respiratory symptoms, muscle aches. So for the common population, you think about it that way as a flu-like illness, although it's different from the flu, and has a different mortality rate and all these sorts of things. So I'll just say that this is something that you will imagine to be like the flu with fever, cough, symptoms, runny nose. And those are the symptoms. And the idea of the curve, since you brought this up, I'm sure all the social media judging who are watching this know about flattening the curve and all this other stuff. But that all these measures, which some might say are draconian or overkill, are because we are now at the exponential part of the curve, right?
I see.
That there was one case, I think the first case in the United States in January.
Okay.
First case in China was in December.
Yeah.
Right, then it became 50,000, 100,000. So in the United States, we had one case in January. We're now in March, and over the last 2-3 weeks, it's been 150, 70, 100. Every day you get more cases. So we're now at the part of the curve that's going to go up very quickly.
Okay.
And this is the
how long? That's the question. I think.
How long is it going to last? But the fact is, and Dr. Fauci said this, right? That the fact is that there are going to be hundreds of thousands of people who are going to get this disease, and the capacity of the United States. I want to stop for a second, but we have to recognize that we are not like other countries, and that we're not testing everybody. So the true prevalence of the disease in the community, we don't know. But we do know that we have community transmission. People can't trace back to China.
I see.
Therefore, it's here. It's already here. Containment won't work. We got to figure out how to manage and mitigate what's here,
I see.
so that, as everybody's saying, flatten the curve, so that we don't have a huge peak
Mm.
of deaths that overtask the capacity of healthcare systems to deal with it.
Mm.
I can talk more about that, but I just think for a general fund of knowledge, we should recognize that it's a flu-like illness. It has similar symptomatology. It's different in its mortality rate.
Mm-hmm.
But the people who are at risk from flu you think about, they are similarly at risk for this. And the last thing I'll say is that two things, right? We should recognize that there's no vaccine.
Mm.
So part of the reason why flu, although it is harmful, people die every year, there's a vaccine for the flu that, at least for some people, we think about herd immunity, some people think about reduces the illness length. There's no such thing. And it's not like a pneumonia, that you get bacterial pneumonia that I can treat you with antibiotics.
Right.
We have no treatment. So
Mm.
the only thing that's left are public health measures,
Mm.
right? And to be honest, we actually don't have a natural history yet. That's why we're saying it's like Italy or China, because this is just not even 5 months old.
Right.